Transcatheter aortic valve replacement has taken center stage with the release of the PARTNER trial data. There seems little doubt of its usefulness. Now researchers from Europe have looked further at some of the predictors of outcome, clearly important for choosing patients. In JACC, they describe the incidence, predictive factors, and prognostic value of myocardial injury during uncomplicated TAVR, or transcatheter aortic valve replacement. They simply tested cardiac enzyme elevation up to 72 hours after TAVR and found some striking effects. 99% of patients had some elevation of troponin and 77% some elevation of CKMB. Not surprisingly, the transapical approach and renal dysfunction were associated with larger amounts of injury. But here is the payoff. Larger amounts of myocardial injury were associated with less improvement of LV ejection fraction, and the degree of rise in troponin was an independent predictor of cardiac mortality at 9 months of follow-up. The presence of prior coronary artery disease was not associated with a higher degree of myocardial injury, and interestingly, no differences were seen between patients with and without complete revascularization before the procedure. More studies are needed to confirm these findings, but in relatively small numbers of patients, knowing that a troponin rise and mortality and follow-up are intertwined, we might consider more aggressive cardiac therapy in those patients that become higher risk after TAVR. I'm Peter Block, and this is a CardioSource Heart Minute.